Because every hair loss is not same. In male, it's a frontotemporal. In a female, this is preserved. This is a major difference.
So the difference between male and female patterned hair loss, what often young dermatologists tend to miss in terms of distribution or in...
This is an important aspect, because every hair loss is not same.
Yeah.
For a common person, if they lose hair, they don't know whether it's a telogen loss or an androgenetic alopecia or something like a diffuse alopecia, senescent alopecia, we don't know. For a young dermatologist, the first thing probably what you should have is a clinical acumen to see the pattern. In male, it's a frontotemporal, which is going exactly like this. Then it becomes thin, which you can see on my scalp. In a female, this is preserved. The central thinning will happen. This is a major difference.
Right.
And of course, trichoscopy is the stethoscope of dermatologists.
Yeah.
If you don't have a trichoscope or a dermoscope, I don't think trichology practice can never be possible. We have gone to such a level with trichoscope. Obviously, you need to use trichoscope for it. Okay.
Right.
So with trichoscopy, you can feel the earliest features of androgenetic alopecia. If there's a 20% variation in the thickness of the hair, if there are some follicles which are empty, which have got a brown color around the follicle, all these will point towards the alopecia, which is of a male pattern or a female pattern. And in female, it's a central thinning that has to be taken into consideration. Most of the time, we don't examine the vertex. I see a lot of my young doctors who practice with us. They straight away put their head so that they don't see the occiput at all. They should see the occiput. That is one of the area where the earliest baldness can be picked. And of course, the hair pull test, where you need to pull and see the integrity of the hair, how much hair is coming out. If it is more than 10 follicles per pull, like I normally do like this and see, I'll show them. If there are more than 10 follicles, there's obviously the shedding phase is there. It can be a shedding phase of androgenetic alopecia or a patterned hair loss.